Hello friends, welcome back to my channel. Today we'll discuss an important topic, that is eating disorders. All eating disorders are more common in females. First, talking about anorexia nervosa. Anorexia nervosa is characterized by the following features like restriction of energy intake resulting in significantly less weight than normal, that is BMI less than 18.5 kg per meter square. The severity of anorexia nervosa is defined on the basis of BMI in adults and BMI for age percentiles in children and adolescents. There will be disturbance of body image, and also there will be an excessive fear of gaining weight despite having significant weight loss. Medical signs and symptoms of starvation such as amenorrhea, lanugo, that is neonatal hairs, hypothermia, dependent edema, bradycardia, these all are seen in anorexia nervosa. Poor sexual development is seen in adolescents. Low interest in sexual activity is seen in adults. Endocrine abnormalities like decreased FSH, LH as well as corticotropin releasing hormone, and there will be increased cortisol. Patients with anorexia nervosa are secretive and deny having any symptoms. More common in females, most common age of onset is in the mid-teens. Anorexia nervosa is a misnomer since there is no anorexia or loss of appetite in these patients. Subtypes of anorexia nervosa are restricting type as well as binge eating or purging type. 50% of anorexia nervosa are restricting type, which is characterized by highly restricted food intake. Binge eating or purging type is alternative with restricted food intake. Binge eating or purging type, there will be episodes of binging and purging. Treatment of anorexia nervosa include hospitalization, which is indicated in cases of dehydration, electrolyte imbalance and significant weight loss if patient's weight is 20% below the expected. Calorie intake is gradually increased. Behavioral therapy should be given. SSRIs, TCAs, cyproheptadine, this should be given for anorexia nervosa. In case of failure to gain weight, suspect purging, that is self-induced vomiting after the meals, and supervision for 2 hours after the meals is recommended. Next eating disorder is bulimia nervosa. It is more common than anorexia nervosa. Usual age of onset is late adolescence, more common in females than males. It is characterized by episodes of binge eating, that is eating a large amount of food in a short duration along with a feeling of loss of control during the episode. Bulimia nervosa is followed by inappropriate ways of stopping weight gain such as purging, that is most commonly by self-induced vomiting, or other ways include the use of laxatives, diuretics, emetics and use of enemas. Hypergymnasia, that is excessive exercising, is also seen in bulimia nervosa. There will be fear of gaining weight. Purging behavior can lead to the following like dental caries, enamel erosions, callosis on knuckles, parotitis, hypokalemic and hypochloremic alkalosis. Rarely esophageal or gastric tear during forceful vomiting is seen. Weight is usually normal, which helps in differentiation from anorexia nervosa. Sexual functioning is normal. Usually patients are not secretive. Treatment for bulimia nervosa is cognitive behavioral therapy as well as SSRI.